本節目為醫療資訊節目，內容及觀點僅供參考，並不代表本台立場。如有任何健康疑問，請諮詢專業醫療人員。
歡迎收睇今集嘅醫護與你，我係 Christina 梁展永。今日我哋會探討一個人生好特別嘅旅程，佢就係懷孕。究竟大家要注意啲乜嘢呢？
我係馮振中醫生，個 topic 就係 Healthy Pregnancy Obstetric Emergency。請收睇。
今日我哋好榮幸，仲邀請咗 Dr. Elena Chan， 佢係產科嘅醫生。我哋而家先睇一條短片。
頭痛啊！救命啊！點解會咁頭痛嘅？張凳，坐下先。咁鬼頭痛啊！會唔會係真係關於我個 BB 㗎？會唔會？不如真係揾陳醫生睇下先。
Hi, Cindy. My name's Kathy. I'm going to be your triage nurse today, and we're going to help take care of you. You look very uncomfortable. Can you tell me what's going on?
I'm so heady right now, and then I feel nausea, and then it's so blurry, and then I'm so sensitive to the light.
Okay, so
And
you're
then
having.
I have a baby.
How many weeks pregnant are you?
28.
28. Okay, so you're having a headache,
Yeah.
blurry vision, and you're nauseous.
Yeah.
Okay, I'm going to get you checked out real quick, and we will get your doctor in here. Okay, I'm going to put
Sure.
these monitors on you to check the baby's heart rate. Are you feeling any pain or contractions
Yeah.
down below?
It's cramping
A
right
little
now.
bit of cramping? Okay.
Yeah.
Let me turn the lights down. Hold on just a minute. Do you know if you have high blood pressure or a condition called preeclampsia?
I'm not sure. I just argued with my mom earlier today. Yeah.
Okay, let me take a...
Sure.
I'm going to put this on and check your blood pressure,
Sure.
okay?
Okay. Do you think my baby is
Let me
okay?
check that. Are you feeling your baby move normal amounts?
Yeah.
Okay, I'm going to put this on your finger. Okay.
Okay.
Checking your vital signs. Okay. Checking your blood pressure. Why don't I give you this too if you feel like, where's my little thing? If you feel like you're going to get nauseous or throw up, here's something to throw up, okay? So it looks like your blood pressure is pretty high today. Has your doctor ever talked to you about preeclampsia, blood pressure?
No.
Okay, I'm going to call your doctor. Sometimes we get concerned for this if you're having a headache. And if you're having high blood pressure, there's a condition called preeclampsia we'd like to check you for. I anticipate she'll do that. In terms of your nausea, are you also experiencing any pain in your upper quadrant area on your right side, your left side?
It's right here.
It's lower, okay.
Yeah.
And then,
Do you think my baby is okay?
yeah, your baby looks okay on the monitor right now. I'm going to go call your doctor. We're going to try and get your blood pressures treated. They're at a severe range right now, and we're going to run some blood work and some urine to check for preeclampsia.
Okay.
And we can also try to figure out where your nausea is coming from and your pain.
Do you know when I can go back home?
We will talk to the doctor first and get you settled and get you comfortable, and then we'll figure out what's going on, okay?
Do you think I ate too much salt? So, like, I have high blood pressure?
No, I don't think it's from the salt. This is a common condition that can happen in anywhere along your pregnancy course. So we will check more blood pressures and also check your lab work, okay? Let me turn your lights down a little bit more to help with your headache.
Okay.
There you go. Okay, I will be right back. I'm going to call your doctor.
Okay.
各位觀眾朋友，大家好！我哋而家嚟到 El Camino 醫院嘅 Neighbor and Delivery Unit。我知道我哋嘅醫院呢用咗好多資源興建呢一個部門喎，不如帶大家去睇下。
剛才第一段嘅情景重演係關於子癇症，症狀包括頭痛、視力模糊同埋腹痛。有請陳醫生同我哋分享更多懷孕期間需要特別注意嘅事項。
喺我隔離咧就係 Dr. Elena Chan， 佢係呢度嘅產科醫生。Elena Chan 你好，陳醫生你好。我相信我哋好多觀眾朋友咧都好想知道關於一啲產科點樣生 BB 啦，同埋有乜嘢嘅資訊啦，同埋呢啲相關嘅症狀喎。咁啊 Elena， 我有一啲問題想請教下你，究竟點樣先知道我哋係懷孕呢？
Oh yeah, so the first sign really is the missed period. That's the first thing you can detect. And obviously pregnancy test, home pregnancy test is the easiest way to detect that. And so the earliest you can get a positive pregnancy test is about around the time of the missed period. And so that's 2 weeks after conception happens. For symptoms otherwise that one might get would be like tender breasts or nausea, vomiting are common.
陳醫生表示，懷孕初期嘅症狀包括月經疑似、乳房灼痛、想嘔，並可以透過驗孕棒檢測同埋確認。
咁我知道咧，市面上就有好多一啲懷孕嘅驗孕棒咧，佢話佢99% 係準確嘅喎。咁其實係咪真係好準確嘅咧？定係要驗血咧？
So the ones on the market for the urine, as long as you're doing it around the time of the missed period, they are very accurate. So false positive, meaning you get a positive pregnancy test without actually having a pregnancy, is very rare. And then false negative, so having a negative pregnancy test when you're actually pregnant would be extremely uncommon. And that would mostly be if the conception actually happened later than you thought.
好多人都好好奇驗孕棒嘅準確性。陳醫生表示，驗出假陽性或者假陰性嘅情況相當之少。
咁我相信咧，好多朋友咧，即係認到係真係 positive 嘅 pregnancy test， 咁啊即刻想檢驗下，究竟想 check 下個 BB 係咪真係有 BB 咧？咁 So how soon can we use ultrasound to check confirm pregnancy?
Oh yeah, so the earliest I typically tell my patients to come to confirm a baby and a heartbeat is around 8 weeks. 7 weeks, probably you can see that, but sometimes people's due dates based on their period is a little bit off, and so if the baby is actually smaller than 7 weeks, like 6 weeks, you may see the beginning of a pregnancy but not yet be able to see the baby or a heartbeat, and that can be very worrisome to patients. So because of that, I prefer people come in when we're sure we can see a heartbeat, so there's less anxiety.
有啲人嘅月經週期會唔準，所以懷孕可能只有6星期左右。陳醫生建議喺孕期8星期嘅時候先去求診，咁樣就可以睇到 BB 嘅心跳。
咁我聽講咧，全美咧其實有1/4嘅女性咧都試過流產喎。咁究竟係咪真嘅咧？同埋究竟點解好早期懷孕嘅時候咧，好多女性都會流產嘅咧
Yeah, so about 10% of all pregnancies that are recognized end in a miscarriage. The biggest risk factor is age. in young women like in their 20s, probably it would be 10% or slightly less than that. If you get over to like age 45 and you're pregnant, then the risk of miscarriage is very high, about 80%, and it slowly increases in between. Most of the time when we do find a reason for miscarriage, it is because of like a genetic problem where the egg has an extra chromosome or something like that. This type of genetic error is more common as women get older, and to a lesser degree also as the father gets older.
流產最大嘅風險因素係年齡同埋基因問題，例如卵子多咗一條染色體，呢啲都係增加流產嘅風險。
咁講開流產啦，咁其實有冇一啲嘢我哋可以做去防止流產咧？係咪我哋唔可以食一啲嘢，唔可以食西瓜，或者我哋唔好喐，唔可以去行山或者做運動，去阻止或者防止流產咧
？That unfortunately is not true. So miscarriages, other than the exception of like smoking and drug use, which both can increase risk of miscarriage. Apart from that, miscarriage is not because of something that the mother does. It's not her fault. It's not because of anything she ate or activities she did. So in general, unfortunately, there's not much we can do to prevent a pregnancy. However, it is also reassuring that it's not because of our fault if a miscarriage happens to us.
陳醫生強調，流產並唔係你嘅錯，同你食咗啲乜嘢或者做咗啲乜嘢無關。請記住，呢個唔係你造成，所以無需自責。好多人都有相同嘅經歷，並會陪伴你走過呢段路。
所以我哋講翻去懷孕咧，可唔可以同我哋講下乜嘢係第一個孕期咧
？We have numbers of weeks for them, but they're all a little bit arbitrary. So first trimester we consider up until 13 weeks. Second trimester we consider between 14 and 27 weeks. And then third trimester is 28 weeks and onwards. When we say a baby's 8 weeks along, that's 8 weeks after the last normal period started. And so she actually did not get pregnant until 6 weeks ago. And so the baby has actually been growing for 6 weeks, but we call it 8 weeks because there's been 2 weeks after the period was when ovulation happens and she conceives.
陳醫生話：第一個孕期係由懷孕開始到第13週，第二個孕期就係由第14週到第27週，第三個孕期就係持續到第42週。
咁其實我以前有好多朋友都問我，係咪有冇一個特別日子咧係最多人生小朋友
？I don't know about those dates, but I do know that in September, the month of September is actually the busiest season on labor and delivery across the country, and that tends to be persistent year after year, and so you can count back, it's around New Year's time.
陳醫生話：9月份係最多 BB 出世嘅月份，幾乎年年都係一樣，所以最常見嘅受孕時間就係聖誕節同埋新年期間。
陳醫生，好多謝你。好似你話懷孕同埋生產係一個人生嘅最大嘅轉變，通常咧都好順利同好安全，但係有8到10% 咧，有時有併發症 （complications）， 好似 gestational hypertension 高血壓 diabetes 同埋早產 premature labour， 所以咧嗰啲病人多數要提早睇醫生，同埋要注意力好重要。咁通常佢需要，如果佢驚住有呢啲問題，或者有咗呢啲問題，佢通常要幾耐嚟睇你呢？
Somebody without any complications yet in the pregnancy should see the doctor about every 4 weeks from the time they establish care, around 8-10 weeks or so, up until about 28 weeks. After that, we usually see people every 2 weeks. up until 36 weeks, and then after that, you see the doctor every single week until you deliver. And of course, if there's complications, then we see you a little bit more frequently.
喺懷孕期間，如果媽媽冇併發症嘅話，產前檢查通常係每4個星期一次，28週之後改為每2個星期一次，到咗36週之後就需要每星期都見醫生。
有一個情況，好多人都好恐懼，就係先試子癇。So let's talk about that. And what is it? 係咩嚟嘅呢？
Yeah, preeclampsia is a little bit hard to describe because the truth is we don't yet know what exactly causes it, but it's characterized usually towards the end of the pregnancy. A pregnant woman's blood pressure may become high. Oftentimes they'll start getting like protein coming out in the urine, and generally just like the fluid that's in the body usually comes out from the blood vessels into the tissues, and so women will experience a lot of swelling, and that can be legs, face, hands. You can see those parts, but also they can happen in the lungs, in the liver, in the kidneys, and that actually causes tissue damage inside, and so that can become very severe. So you get short of breath, pain in your right upper quadrant where the liver is, or so kidney damage would cause protein to come out in the urine. But high blood pressure really is the main key feature of that.
子癇前症多數喺懷孕後期出現，症狀包括高血壓、腳部腫脹、右上腹痛等等。假如發現呢啲警號，孕婦一定要立即求醫。
So are there any warning signs?
Typically, once somebody has symptoms, it's usually very late and already quite severe. And so that's part of the reason why we do prenatal care at all, is so that we can check the woman's blood pressure, because the blood pressure going high is the first thing that you would see. Otherwise, in the early stages, a woman will not have symptoms. She may get swelling, but normal pregnancy also has swelling. So that's not very specific for preeclampsia, but the blood pressure is the first thing. Symptoms that a woman may get from preeclampsia would be like a severe headache that doesn't go away with Tylenol or other medications. There can be like spots in the vision or pain in the right upper belly. But once someone gets these symptoms, it is by definition already severe.
陳醫生強調，如果出現頭痛同視力模糊或者其他可疑症狀，千祈唔好忽視，一定要立即求醫。
如果佢以前有過依個症狀，佢有咩方法可以防止去發生呢？同埋佢早期有咩方法可以避免呢件事發生呢？
Yeah, so once somebody has preeclampsia during one pregnancy, they are at fairly high risk for having it again in their future pregnancies. The only proven way that we have to help reduce the risk of preeclampsia now is basically taking like a small dose of aspirin, a low dose aspirin, starting around 12 weeks of pregnancy until full term or until delivery. And that, of course, cannot prevent it for everyone, but it can reduce the risk, especially the risk of getting severe preeclampsia very early in the pregnancy, which then puts the woman at risk of preterm birth. If they're early on in their pregnancy and they need monitoring, we'll start doing twice a week what we call NSTs, so non-stress tests. And so that's a test where we put on some monitors to listen to the baby's heartbeat and watch the contractions for about 20 minutes. And it gives us a good idea of the well-being of the baby. And as long as the baby is doing well, and we also check the blood pressure at all of these appointments, which are usually twice a week. That's how we monitor for severity, and then typically also once a week we'll check the labs and make sure there's no lab abnormalities.
如果媽媽之前有子癇前症，下次發生嘅機會會更加高。陳醫生建議喺懷孕12週開始服用低劑量嘅阿士匹靈，以防子癇前症。如果出現任何併發症，就需要做無壓力測試，以監測胎兒嘅發展情況。
如果真係有咗，有咩治療方法呢？
Unfortunately, the only way to cure the preeclampsia is delivery. So delivering the baby and the placenta. It's thought that the placenta, a reaction of the mom's body to the placenta, is what causes preeclampsia. So that's the only way to cure it. And so short of delivery, of course, if somebody is like 29 weeks, you don't want to deliver too early if you don't have to. And so in those situations, we just mostly monitor closely, monitor the baby, monitor the mother, the health of both to make sure that both are stable. And if possible, for people who remain stable, we'll deliver at 37 weeks. If somebody becomes what we call severe preeclampsia, then the goal is to keep the blood pressure low enough that they won't have a stroke, won't have seizures with blood pressure medications, and monitor their labs, and of course monitor the baby and the mother, usually in the hospital setting rather than at home if they're severe. And the goal is to try to get them to 34 weeks before we deliver the baby. Otherwise, if the mother becomes unstable, the baby becomes unstable at any point, then we just deliver.
子癇前症唯一嘅治療方法就係分娩 BB 同埋胎盤。如果症狀屬於輕微，醫生會繼續監測血壓。但如果情況嚴重或者有中風嘅風險，就需要提早分娩，以保障母嬰嘅安全。
好多人都會問我嘅，雖然我唔係婦科，佢話你過咗幾大年紀呢，就應該唔好生仔啦，唔好生女啦。咁係咪真係啱嘅呢？
Yeah, that's a complicated question because there's usually when people try to store their eggs or store their sperm when they're younger, the purpose mostly is to overcome any problems of infertility that may happen with age, which is relatively common. And so for the woman, for storing the eggs when she's younger, it will decrease the chances of the eggs having genetic problems, so then decrease the risk for miscarriage. And then also, if she has fertility problems later on when she's older and ready to have children, the eggs will be her backup. But I think it's very important for people to realize if an older couple chooses to undergo IVF to help them, it may not actually decrease their risks of having complications during the pregnancy because IVF is actually itself a risk factor for many pregnancy complications. And so if somebody is able to get pregnant and not miscarry, even late 30s is pretty common, even early 40s now, if it's possible to do it naturally, I recommend naturally because IVF is a risk factor for preterm labor, for growth restriction of the baby, for preeclampsia, gestational diabetes, problems with the placenta, needing a C-section. It's a risk factor for all these things just by being IVF alone. And so I would recommend reserving IVF for issues of infertility or other specific circumstances.
Apart from being very expensive.
Yes.
陳醫生建議喺懷孕期間，準媽媽一定要做定期檢查，密切留意血壓同埋身體狀況，咁就可以降低其他嘅風險，保障媽媽同埋 BB 嘅安全。
好多謝 Dr. Elena Chan 同我哋分享咁多寶貴嘅知識，我相信在座嘅觀眾朋友都學咗好多資訊。我哋下次再見。
多謝觀眾收睇，再見。